everyone, and welcome to today's webinar presentation, Life History Timelines, a trauma and violence-informed approach to exploring clients' experiences of adversity and resiliency. My name is Sarah Carsley, and I am an Applied Public Health Science Specialist at Public Health Ontario, and I have the pleasure of co-moderating today's session. Before we begin with today's presentation, I would like to acknowledge that I am in Toronto, on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties signed with multiple Mississaugas and Chippewa bands. I'll now mention a few housekeeping items. To enhance the presentation experience, participant audio-visual has been disabled. The chat pod has also been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have any questions during the session. A discussion and question period will follow the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. I would now like to introduce my co-moderator for today, Lindsay Croswell, who is a community health nurse specialist with Middlesex London Health Unit and the Ontario Nurse Family Partnership Nursing Practice Lead. She is also a member of the PHN Prep leadership team. Over to you, Lindsay.
Thank you, Sarah. I'm thrilled to be here today. Good morning. Thrilled to be co-moderating with you and representing the work of the PHN Prep team in supporting PHNs, supervisors, managers, and home visiting staff in their work with families. Today's webinar will discuss the construction of a life history timeline as a trauma and violence-informed approach to assessments. It will also highlight the life history timeline and how it helps foster rapport and trust between provider and client, as well as to create an opportunity to reflect on how past experiences can inform the client's own personal vision and goals for parenting. It's now my great pleasure to introduce the speaker for today's presentation, Dr. Susan Jack. Dr. Jack is internationally recognized for her work in public health nursing practice, education, and research. She's the lead of the Public Health Nursing Practice Research and Education Program, the PHN Prep, and Dr. Jack and her team are committed to integrating the principles of trauma and violence-informed care into professional practice and curricula as a strategy to improve client engagement and health outcomes, as well as to promote provider wellness. I'll turn it over to you, Susan.
Great. Sarah and Lindsay, thank you so much for that warm welcome and introduction. Good morning to everybody. Lovely to see all of you here again for another webinar. And as already has been identified, our focus today is going to be talking about life history timelines. And life history timelines as a tool and a process that I think is a really flexible tool that nurses or any clinicians who work with pregnant individuals, parents, caregivers, or families can think about integrating into their practice. So our objectives for today and the hour that we're together is to just begin to discuss who and when you might use a life history timeline. I'm going to focus most of our time on how you introduce and complete a life history timeline in your practice, and then to think about how this information, this assessment information that you gather in this process can then be used to inform future actions or interventions with your client. So as nurses, as public health nurses, or if others of you are other healthcare professionals, I would imagine that health assessment is really one of the first steps that you do with any client that you work with. When I think back to my first year of nursing school, the very first thing we learned was the nursing process, which is assessment, diagnosis, planning, implementation, and evaluation. And again, that first step is assessment. Anytime we're engaging with an individual, a couple, a family, a community, a population, we are focusing on collecting information. And assessment is a systematic and dynamic way that we collect and we also analyze that information. And that information is not just collected for the organization. Assessment information is collected so that we as the healthcare professional can use our clinical judgment and our critical thinking skills to understand what are the needs and priorities of the client or population that we're working with, and to use that information to inform then what is the plan or the care plan. And for, some of you were here last month when we talked about trauma and violence informed approaches to assessment. So today I'm really going to focus in this conversation in the context of working with families and with examples from home visiting practice. And I think there's many different reasons on that first or second home visit that we start to ask questions and collect information from clients. I think one of the first reasons that we do that is we're trying to establish rapport. We're trying to get to know the family. And you think about it, even when you meet a new neighbor or meet someone new at work or meet a new friend, we ask questions because that's part of our human nature, is to be interested, to get to know someone. So those assessments start to serve that function, just to get to understand who the individual is, what has happened to them. Of course, from the healthcare professional perspective, those early assessments are so that we systematically gather information about their health and social history. And in public health home visiting work, and again, in many contexts where individuals work with families, these histories are often focused on what are their current or past health concerns or issues, often focused very, comprehensively on understanding physical, mental, emotional, and social health. We've identified that about 50% of you collect assessment data on adverse childhood experiences. I anticipate many of you ask questions about the social determinants of health, recognizing that both adverse childhood experiences or an understanding of social determinants of health, that's important information that helps us understand what has happened to these clients, what have been their past experiences, influences, their current or future behaviors or health outcomes. So, within that same vein, we're often collecting information perhaps about substance use, about their experiences of different forms of violence or trauma in their life. And very often, and again, 87% of you confirm this, that you're collecting this information and then you're analyzing it so that you can identify what are some of the potential risks to health, to parenting, that need to be understood and then minimized or addressed, as well as what are the client's strengths that you can build on as you develop that plan of care. And I also think then that assessment data, once we identify those strengths and risks, really helps us to identify, what are the client's needs, what are their goals, and then how do we work with them collaboratively to identify what are going to be the resources, support, services, or interventions that are required to address those needs and goals. And there are challenges to assessment, however. And so if you think about the work that you do, and for those of you who joined us last month, we talked about this a little bit more at length, but there is evidence in the literature to support that assessment's not an easy process. We don't just walk into a home, ask a list of questions, and clients voluntarily share their entire life history with us and provide us with the rich, detailed data that we need. What we know for nurses and providers, some of the challenges with assessment is often assessments are incomplete. They may not have enough time to complete comprehensive assessments, so there's missing data. For some providers, there may be challenges in knowing when or how to ask questions, specifically about sensitive questions. And that's often tied for providers in not necessarily a lack of knowing how to ask the question, but more a concern or fear or worry. Boy, if I ask some of these sensitive questions and the client discloses, what do I do next? How do I manage that disclosure, particularly if time is tight? And similarly, clients also experience challenges when a healthcare professional comes into their home or into their care setting and is asking lots of questions. Clients may be really hesitant to, particularly early on in a relationship, to provide detailed information, particularly if they're unsure of who's going to see this information, how is this information going to be used, if they're unsure of why you're asking these questions. For clients, that creates concerns about, privacy, safety, confidentiality. Some clients may be really reticent to talk about their current experiences or even their past health history, because if rapport hasn't been established, there may be a fear that they're going to be judged by the healthcare provider. And for many clients that we work with, if they have had traumatic experiences or a history of trauma, if we accept and acknowledge that experiences of trauma impact and change how people's brains work and function, that they may have problems remembering or challenges remembering information. It may be difficult for them to recall information. So during an assessment, they may be sitting there going, oh, I don't know, I just don't recall. So that's a challenge for the client, a challenge for the nurse, again, because they have incomplete data. And we also know from our research and just from anecdotal experiences working with clients and nurses that sometimes, particularly if we're working with clients who are system-involved clients, that there's a real fear or hesitancy to share because of that fear of mandated reporting. So if we start to change the lens and start to go, okay, how can we use trauma and violence informed care principles, which are summarized here on this slide? How can we use these principles to start to minimize some of these challenges? And essentially the goal of using TVIC, or trauma and violence informed principles, is about, in every encounter with any individual, with a colleague, but in this context with a client or family, how are we always walking into a situation being trauma aware and working to prioritize the creation of an environment where the client feels emotionally and physically safe, and where we are giving opportunities for the client to really feel like they're working with us in collaboration, that we're prioritizing the establishment of a therapeutic relationship, and that we're giving clients choice in the different ways in how we engage. So I'd like to, present or suggest to you that a life history timeline is a TVIC approach to assessment. And these timelines that I'm going to teach you about today provide us with a process where we can have discussions to learn about historical risks, including ACEs, including histories of trauma. I'm going to provide you with a script or a process to ensure that we're providing anticipatory guidance, or we're making it really clear to clients why we're collecting this information. The construction of a timeline is different from when we used structured interviews or structured assessment screens or tools. The development of a timeline occurs through a discussion. And it's a discussion where, as a clinician, we're engaging with the client from a perspective of curiosity. We're asking questions around, I wonder, or could you tell me about? So really to have that engaging discussion. In these life history timelines, we give clients control of the narrative. We ask them what they would like to share with us. So they have control of the narrative, they have choice on what to share. And again, because it's going to be a discussion approach, we're really using open-ended questions to establish a connection. And then as we go through the life history timeline, you're going to see how there's a nice balance where we can focus on not only what are some of clients' risks, but what are some of the strengths, what are some of the events in their life that created resiliency, particularly in the face of them experience, trauma or more negative events. And then finally, at the end of us discussing the construction of a life history timeline, I'm going to talk about how you can take that information and share it with the client and begin to think about how that information can be used to support the client to identify some of their short or long-term goals that they would like to work on during your home visiting work with them. So what is a life history timeline? And this is an example of a life history timeline shared with permission from a client. Life history timelines, they have many different names. They are also called in the literature life history calendars, or they're called biographical timelines. This is both a tool and a process to engage in trauma-informed assessment. And these tools are used in many different professions, in counseling, psychotherapy, psychology. They're used in context with, particularly a lot with adolescents who are involved in juvenile services or counseling. That's where the majority of the evidence or literature on these tools have been collected from. And life history timelines allow us to collect data about different types of events that have occurred in the past. So this isn't a historical assessment. And it allows us to gain insight about the timing and sequencing of events, as well as the context of where these events occurred. So where the events occurred, who was the client having relationships with, or who they were involved in. And the literature suggests that some of the benefits of co-constructing life history timelines with clients is that they foster collaboration. It's really a conversational interaction, that this type of approach to assessment promotes engagement and rapport. There's evidence when they've done surveys of adolescents who've completed these, they report that this is a more enjoyable experience to engaging in an assessment. And that there is some evidence that when we do life history timelines, particularly with individuals who've experienced trauma, there's evidence that this process increases the interviewee's recall. There's less effort to pulling this information from their brain, and it promotes greater understanding for the clinician in understanding what the client has experienced. And in one study that looked at the use of life history timelines with adolescents, and the timelines were being used to document information about adolescents' sexual risk behaviors, what was reported was that, the construction of this life history timeline really provided the interviewee with more time and space for reflection, which allowed them to provide more accurate or truthful data, really to reflect on what had happened to them. And that they talked about that sitting side by side rather than face to face with the clinician created a safer space where they felt less judged. And when I was reading this in this research article, I thought, yep, that once again reaffirms the value of side-by-side conversations. And I think about all the times with my young adults, but when my teenagers were at home, if I was grilling them like face to face, I would get no information from my boys. But when we would be sitting in the car driving to hockey or rugby or soccer or tutoring, and we're sitting side by side in the car, and I'm just asking some open-ended questions, how much easier it was for them to open up. And I thought that just creates, again, that safe space. They're not being grilled, interrogated, challenged. It's a side-by-side conversation. So this process of developing a life history timeline replicates that. Now, if you're just sitting there at your desk, I'd like you, if you have a piece of paper and pen handy, just to grab one. I should have said that earlier, but if you've got a paper and pencil handy, just grab one. And because maybe as we're talking, you'll start to write and think about how you would ask or how you would even create your own life history timeline. And life history timelines don't need any special tools, or you don't need anything special in order to do these. And actually, it's a flexible tool that you can do in any context. In the work that I've done with nurses who engage in home visiting programs and working again with pregnant individuals and new parents, The only tools they often need is stickers, markers, and a big piece of paper. All of this can be, bought at the dollar store. But if you don't have this, just a piece of paper and a pen works. And so to start a life history calendar, I think, again, if we're looking at the principles of TVIC, it's so important to always explain what we're doing and why we're doing it. So if you were, imagine you're the client and I'm the nurse coming into your home, I would start to say something to you like, as part of this home visiting program, we're going to be meeting regularly, maybe about every 2 weeks. And we're going to be working on different goals that are important to you related to your health and well-being, to parenting, to your baby's growth and development. And since we're going to be spending this time together, I'd like to get to know a little bit more about you and your life to this point. And in addition to helping me to get to know you, this information is going to be helpful to understand how some of the events that you've experienced in your life have influenced your health and your well-being, and also to identify some of the short and long-term goals that you're going to work on. So to do this, to get to know you and to begin to think about what are some of your goals, I'm going to sit right here beside you, side by side, and on this piece of paper, and if you want, using these markers and these stickers, I'm going to ask you some questions. And if you feel comfortable, start to draw your responses on this paper. And then afterwards, if you're comfortable, we're going to have a discussion about what you're drawing. And I want to assure you, I'm not an artist. This is not an art project. So don't worry about making it pretty. Just draw what you feel. And you don't have to answer any questions. If any of these questions feel uncomfortable to you or a bit too sensitive, you can just say, Susan, I want to pass. Because I know sometimes in creating these timelines, we might start to talk about some sensitive topics or events from your past. And, today in this home visit, depending on how long we talk, it might take about 30 to 40 minutes to create one of these life history timelines, but it doesn't have to take that long. We can always start and complete what we can today, but we can revisit it on another day. So is it okay if we begin? So that's a little bit of how I would introduce this type of timeline to a client. And then we would start. And to start with the timeline, I would say to you, there's really only two things we probably know to be true. You probably know your birth date. So anywhere on this piece of paper, I'm going to ask you to write your birth date at one end of the paper, anywhere you want. And then at the opposite end of the piece of paper, or at the opposite corner, put today's date. And I always have a hard time remembering today's date. So, it's December 14th, 2022. So write those two dates. And now as you look at this piece of paper, and I want you to think back to the period of time between your birth date and between today's date. And I want you to think about what are three of the most important or significant events that have happened in your life. I'm going to ask you then to just put those sort of in a timeline where they would fit. So name those three events on your timeline. And then just, underneath either put the year or even how old you were when those events occurred. So in a life history timeline, that's how we start. We start by asking the client to pick some landmark events. And these landmark events are going to be where we start to focus and then expand our conversation around. So in the construction of this life history calendar, the client chose, her first event was that at age 4, she went to live with her mom. When she was 12, she was the drill team, or she was in a drill team competition. And then the third most important event in her life at this point in time was her 18th birthday party. Now, as clients start to put these events, as a clinician, we need to know why these events are being put down. And we're having these landmarks events put down so that we can start to understand what has happened to them in the past. Have there been experiences of trauma or violence or ACEs in their life? Who are the people that have been in their lives? What are the relationships with individuals in their lives? What were the contexts of their home life with the people that they were living? And then also what were their sources of support and strength and resiliency that were occurring? So in the training as a clinician to learn how to do a life history timeline, it's really important that you always have a set of open-ended questions at the back of your mind, to start to say, okay, I'm going to ask the client, again, giving choice and control, which event would you like to start to talk about first? When you first went to live with your mom, or when you were 12, or at your 18th birthday. And in this situation, the client says, well, let's start chronologically. Why don't I start to talk about when I was 4 years old and I went to live with my mom? Okay, so I'm using this landmark as the opportunity now to expand. And as the clinician, I would start to ask questions like, okay, who were you living with? Where were you living? What was the nature of the relationships with everyone you were living with at that time? And with this life history calendar, I also asked the question, well, why when you were 4 did you go to live with your mother? Can you help me to understand from the time that you were born until when you were 4 years old, where were you living and who were you living with? And this created an opportunity for the client to explain that when she was born, her mother was incarcerated. And at that time, her grandmother received custody of her. So the first 4 years of her life, she lived with her grandmother. She lived, and her grandmother, her aunt, and her aunt's child also lived with the grandmother. So from 0 to 4 years, while her mother was incarcerated, this client was living with her grandmother, aunt, and her cousin. But at age 4, she was, her mother was able to get visitation and then custody once her mother was released. And so in this conversation, the conversation said, okay, well, when you were living with your mom then, who else did you live with? And she explained, well, I lived with my mom, I lived with her boyfriend, and then the two of them eventually had my baby brother, and her baby's brother's name was Ty. And in asking this, and saying, as you're, can you put some stickers, represent these people? You'll notice that this client put a big black box. And I might say to the client, help me to understand why you drew this big black box. And this client then went on to explain that this was not a great situation for the 3 years that she lived with her mom and her boyfriend. And through prompting of asking questions around what were the relationships like, the client started to share over time that within this context, within this home, that during this period of time, her mother struggled with anxiety, depression, substance use, which she was able to stop when she became pregnant and delivered the client's little brother, Ty. And it was an explosive environment, that the mother's boyfriend also used substances, mostly alcohol. He had an explosive temperament. While he was physically and emotionally abusive towards the mother, he did not physically harm the children, yet he was emotionally abusive towards the children, and they all struggled financially. So just in asking some open-ended questions, so much information was obtained. So in the life history calendar, we continue then to invite someone to expand on the details of their life history, but only of what they're comfortable about. And at some point, as a clinician, I'm going to say, okay, Let's transition now. You drew a box around the ages from 4 to 6. Does that mean that you lived somewhere else after age 6? And again, this client affirmed that yes, given what was happening in the home with her mother, at age 6, she moved back in with her grandmother. So her grandmother was able, to, and I don't recall the details, but to either regain custody, but she moved back in with her baby brother, with her grandmother and her aunt's children. And this, you could see the client drew this in pink. And she talked about this being a much more positive and supportive time. And because her grandmother worked so much, she spent a lot of time at school and at church. And at school, she became involved in a drill team and was at practices, and that really became a place where she developed strengths and had supports and felt success. So as we go through this, the client is filling in the details. And I think this is something that's a real strength of a life history timeline, is that in most cases, clients, when you ask them to document the 3 most important events or significant events in their life as those landmarks to start, very often those events may have been a traumatic event or a significant move or transition in their life. So as a clinician, it's important for us to also then make sure that we are asking questions around, well, during this difficult or challenging time, or during this time when your mother was incarcerated, were there other people or supports that were there that had a positive influence or that you felt connected to? And this allows us, again, to collect that information around both risks as well as the contextual factors that help create resilience and strength in clients. Now, as you do these timelines, one thing, and again, if we're practicing from a TVIC approach, is always to remember that we are asking a client to think back on what has happened to them. So critical as a clinician that we are trauma aware and that we are observing and we're watching the client for cues. If they start to, look like they're getting stressed, flustered, all of a sudden they're like, oh, I can't remember the details, agitated, fidgety, those might be signs of a traumatic stress response. And that might be our cue to say, would you like to continue? We've already talked about a lot today. Maybe we should put this aside for another visit. And then maybe do a grounding exercise or any of the skills that to support a client who's having a traumatic stress response. So it's important to be, trauma aware, to be sensitive to those cues, to give the client a choice or an option if they want to continue or not. So if we continue on with this life history calendar, and I could talk about this one forever, and I know the time's always running out. As the client continued to talk about her life history, you can see more details were added about where she lived. When she was living with her mom, she was living in the lower ninth. This life history one was conducted with a client who lived in Louisiana in a home visitation program there. Her grandmother lived in a different district. So it allowed for questions asking about characteristics of the community, of the neighborhood, asking for questions about what resources or supports were available, about the income, about the safety of the neighborhood. So again, just by asking, where did you live? We get a lot of information about social determinants of health, exposure to ACEs. And again, as this client continued on, she talked about all her successes in high school, of being on the drill team, the debate team, the honor roll team, about having her first boyfriend, towards her later years in high school. And, the reason that she put her 18th birthday as a significant event is she said that she was at her 18th birthday party, and she really remembered clearly being really sick at her 18th birthday party. And her friends were joking with her because she wasn't drinking. And she's like, I'm not drinking. I don't know why I'm sick. And her friends joking with her, well, maybe you're pregnant. And as it turned out, she did shortly find out after her 18th birthday party that she was indeed pregnant with an unanticipated pregnancy, which is one of the reasons why she was then subsequently enrolled in a home visiting program that enrolls young girls early in pregnancy. So this is an example of what an almost completed life history calendar would look like. And, through the conversation and creating it with a client, you're collecting your assessment data. But the other power, this is the tool, but the other powerful work that occurs when you co-create the life history timeline is the process, the discussion. And what can be really, I don't know if the word is empowering or helpful or supportive, is to create space for the client to reflect when you're almost finished the timeline, and to ask the client, as you see your completed timeline, when you look at this, what stands out most to you? What were the experiences that were the most difficult for you? What experiences helped you to become strong? And in home visiting, if the purpose of your home visitation program is to promote healthy growth and development, or building parenting capacity, we can also start to then tailor questions to, when you look back on how you were parented or raised during your childhood, what are some of the things that you would like to do as a parent with your child? What are some of the things that you would like to do differently? So these questions plant the seeds to help us to identify short and long-term goals related to parenting with the client. And then we can ask the next question, given that, I'm wondering if you have any ideas then about what you need and want for yourself and your baby. So again, this information helps to establish goals, and it helps to start to think about how do we use this data to inform our plan of care. And for the 50% of you that do collect ACEs assessment data, and for maybe there's health units or programs out there thinking about how do we learn more about clients' adverse childhood experiences, this life history calendar can help you do that. Of course, nurses need to know what are adverse childhood experiences. There's been a lot of effort and investment in many communities, particularly in the United States, to advocate for screening of ACEs using very structured tools where you ask about an individual's experience or exposure to 10 adverse childhood experiences. And from the CDC and Kaiser Permanente study of ACEs, typically the 10 ACEs that they ask about in the most common ACEs screening tool are individuals' experiences of abuse in childhood, experiences of neglect, or 5 attributes related to household dysfunction. And so you can see those there on the graphic from the Robert Wood Johnson Foundation. And I've circled in red the 5 ACEs that we were able to elicit through this life history calendar. Through this side-by-side discussion, the client was able to share, experiences of emotional abuse in childhood, particularly in those early years where she was living with her mother and her boyfriend, and that was certainly a home where her mother was experiencing mental health issues, where there was substance use both on the part of her mother and her mother's boyfriend, where there was that child was exposed to intimate partner violence. And then early on in her life, she had an incarcerated relative that her mother was in prison. So right here, we can see through this discussion that this client experienced 5 adverse childhood experiences. And in typically, if you're familiar with work around ACEs, they talk about, 4 or more, that if a client has shared, experiences of 4 or more ACEs, that is quite significant, and that those early childhood experiences, that there's evidence to suggest that those change how the brain works and functions, increases the likelihood of them engaging in high risk behaviors themselves, becomes risk indicators for them engaging in relationships where there's violence or abuse. And, exposure to ACEs can be predictive of long-term chronic health issues, diabetes, heart disease, cancer, just to name a few. So I just wanted to show you that this can be an alternate approach versus a structured screening tool to be able to identify ACEs if you do ask about ACEs in your program. So once you create a life history timeline, what's next? At the end of the visit, it's important to, in your program or your policies or procedures, if you use this tool or process, to really have a clear understanding of who keeps the timeline. It's my belief that this is the client's life narrative, and that the client should always be given the option to keep this timeline, and that as a clinician, in order to get the data we need so that we can go chart on the data or record it, that we could ask permission to take a photo of the timeline. So we have a photo of the timeline that we can then use to chart, but the client gets to keep the timeline. Some of you may be doing home visits where a partner is present in the first or early home visit. And I would suggest that if the client and the partner are there, that this is an activity that can be done with both of them, and have them both walk through their own life history timelines. And I think there's value to that as well, particularly if you're working with young mothers or young parents. Very often these are relatively new relationships, and they can learn a lot about each other. We will also learn about the partner's experiences and histories of trauma as well. And then it creates an opportunity for them as a couple to also talk about their different experiences of parenting, and maybe some early insights around their different goals for parenting, or maybe what their different approaches to parenting will be. So lots of good information that as a clinician may be really valuable to helping you develop that care plan for that family, or that family service plan. Again, what's next is, if you're using these within your organization, important as a team to think through, well, how will this information then be used to identify client needs, to build that family service plan, and then also what is the process for documenting the assessment data obtained from the life history timeline. And today this is just a quick introduction to a life history timeline, a quick example of one being constructed, but it is a skill. And I always think that it's so important that when clinicians are introduced to new tools or to new skills or new processes, that they have an opportunity to really, engage in either a workshop or an opportunity at a team meeting to develop these skills and to practice these skills, and to think through, how am I going to do this, to build your own scripts in your head, to know the types of open-ended questions that you need to be aware of to elicit the information that your program needs or that you need to identify client goals. So if any teams are interested in doing this, I would recommend that you spend, a team meeting together, thinking through how are we going to use these tools, and to do some role playing. And if you're doing a workshop or in-service or building those skills, important for you as a team to think about, well, why is this data being collected? What is the type of information that we as a program really want to ensure that we're eliciting? And then I really encourage that if you're doing, again, this type of work, that you spend time role playing with each other and practice with your colleagues in building these life history timelines. And not only in the building, but take the time to role play how you will debrief and summarize the timeline. So I'm going to stop there, and And hope you've appreciated or liked this quick introduction to another tool and process to collect assessment data in home visiting programs and open it up. And I think hopefully Lindsay has some questions.
Thanks so much, Susan. And we are going to open up the question and answer. So if you haven't already typed a question in and you're thinking of one, please send any in. I have a few to start with because we don't have any to begin. And my guess is that most participants are taking notes and thinking about how they can incorporate into practice, because I'm assuming everyone is going to be quite excited about the possibility of using this as an assessment strategy in home visiting, if you aren't already familiar with the process of using a life history timeline. So I thought I'd ask to start if you can share any feedback from clients on their experience that you've heard through nurses, given your experience with this as an assessment tool. Any feedback from clients, because that's a question that's come up to say there's always a concern of asking about, of course, history that might not be as positive, if that can be triggering, if that's the word that gets used often. So any feedback, from clients, because I know we've heard some.
Yeah, absolutely. And just recently I had the opportunity of working with a PhD student who is using these types of timelines with adolescents who are going through gender transition. And we had this exact conversation that reflecting back on their timeline as they're having like gender affirming surgery and as they're transitioning as young adults, that creating the timeline for them created an opportunity to reflect and think back about all the different events and how they've been linked. So they talked about the value of being able to lay everything out and see it for themselves of how much has happened or how much growth has occurred or where some of the challenges are. So there was those benefits, but certainly one of the challenges was the risk of re-traumatization and becoming emotional in thinking through events of maybe bullying at school or feelings of exclusion, or times or events where parents or caregivers were not supported and they found themselves, experiencing precarious housing or couch surfing. And so I think as clinicians, it's so important to be aware that we are asking sensitive questions. And whether we use this process or assessment tools, we're asking sensitive questions. So important that anticipatory guidance and framing up front. We're going to be asking sensitive questions. You don't have to answer. You as the client have control of if we stop, if it's too much, we can continue on another day, but only with your permission. Do I have your permission to do this? So important to frame up front and let clients know. And then during the process, how critical it is for a clinician to be trauma aware, to recognize what are signs of a traumatic stress response. And again, if a client's becoming agitative, defensive, emotion, crying, I can't remember, like something in their head, if they're looking like they're dissociative, those are signs of a traumatic stress response. And as a clinician, do we know what to do in that moment, right? So to check in with the client, would you like to still continue? Do you need a moment? Would you like to stop? What strategies, when you felt like this before in the past, what strategies have you used to manage this response? Should we do some deep breathing? Should we do a grounding exercise? Sometimes people talk about, use of essential oils, just for something to smell different, giving a piece of mint gum to chew just in those grounding. So I think that it's a really important question. So thank you for that, Lindsay. And then from clinicians, and again, some of our research with nurses in the Nurse Family Partnership, what we heard when nurses use this tool as part of a pathway to identify and respond to intimate partner violence, they said, oh my gosh, this took so much time, but it was so valuable. And particularly in some of the programs in the United States that we were working with, they said, we completely refigured. They introduced it around the 4th or 5th visit with a client. And they said, we just completely reconfigured our program and made sure that we knew that home visit would be a little bit longer. And the nurses said, but we got so much information about so many different things that it really created a solid foundation for moving forward with a client.
Thank you so much, Susan. That's really helpful answer. I know we've heard from nurses using it in the NFP program, how powerful this can be for clients and how no other service provider has sort of taken the time to let them tell their story in this open way. And actually, this is a nice lead into, there's a few questions that have come in now around, I think the more logistic, how to do, when to do. So I'm going to group them together. If you can comment sort of on them as a group, it's a lot of them coming from the HBHC program, where we're talking about how to use with, in and around, or in conjunction with the in-depth assessment or the IDA. So questions around like, would you introduce this at a first visit or a second visit with the IDA? Should I take notes for the IDA while the client's doing this? How it fits in with the in-depth assessment or doesn't? Would it take away from the IDA? So you can get a sense of, we've had a few questions come in around that. And another one logistically, if you could also comment on, is about barriers to literacy. And so are we able as nurses to offer writing portions for the client if that is something that is possible to do? So I'll pause there.
Okay. My answer usually to everything is it depends. It depends on the nurse, the context, and the client. So around literacy, I think, this is a tool and a process, and we can teach how to do an assessment. But every healthcare professional and nurse walks into a unique situation with a client, and you're always going to be assessing, is this a tool that makes sense to use with this client? It may not be the greatest or best tool for every client, but there certainly will be clients that it does work for. So a nurse always needs to use that critical thinking and clinical judgment skills to determine, does this make sense? Some clients will be like, I'm not drawing, I'm not doing arts and crafts. Okay, well then maybe that's not for them. But around the question of literacy and barriers, I would imagine, I haven't done this before, but that with the client's permission, if they are talking, or even if there is permission to do this with a professional interpreter, and you say to them, okay, as you're talking, why don't I write it down? But you're always checking with them, right? So I would do that did I get this correct? Is that accurate? Is this what you meant? I don't think there's any reason that we couldn't do that drawing, because it's about creating a visual timeline so that we and the client are looking at something that we can reflect on, that they can expand details, that we're asking the questions that we need to know. And then at the end, we have something constructed that then we can say to the client, when you look at this, tell me what you see. And then from what you've shared, how do we build on this? So I see no reason why, if there's literacy concerns or any concerns around drawing, why the nurse can't do it. But again, I would ask permission. I would be doing that validation checking. Am I getting it right? And then when I'm charting, I would document something like life history, timeline completed, questions were asked, nurse constructed it, right? Just so that it's really clear that it was the nurse constructing it. Now, with respect to the IDA, okay, I'm just going to speak, what I think from nursing principles. So the family assessment, or the in-depth assessment, which is a required assessment tool as part of Ontario's Healthy Babies, Healthy Children program. Of course, the decision to use this tool to support the collection of data to complete the IDA has to be a decision that is made locally within a public health unit. Do I think it's possible? Yes. I think that if a nurse knows the questions that are being asked on the in-depth assessment, that this is an approach that can be used to elicit that information. So there's information around, I think, history of maltreatment in childhood or child abuse, or current experiences of relationship, or the clients, and I don't have the IDA in front of me, and it's been a long time since I've administered it myself, but questions about clients' expectations or plans during pregnancy. Certainly those topics are questions that can be asked in a life history timeline. What becomes important for an organization? So this is just a tool to elicit information. And I've often thought with the IDA, if you're sitting there with it, I don't know, is it 4 or 5 pages with those big boxes? And if we have nurses, and particularly novice nurses, that are just going from question to question to question, I think that's a good example of a tool where there's probably a lot of missing data. And those are really sensitive questions. And it's hard, especially if you're doing it on your first or second contact with a client. The IDA is probably a difficult tool to get a lot of rich data about a client. I would think if you use the timeline and spend 45 minutes to an hour with a client constructing this, you can get the same data as long as there's a process within your organization on how you take that data that you've elicited, on how you go back and document it as part of the IDA. So I absolutely think it's possible, and that type of information could be elicited.
Thank you, Susan. We have time for one last very quick question that I think will answer a couple people's questions they've had around anything available. And this participant asks, are there courses available for nurses to engage in on this? But is there something that a team can use to debrief, talk about, and create? So I had typed back to someone around Susan's graciously offered to try and put together sort of a team-based learning activity around this information. But if there's anything in addition, or the research you're mentioning, Susan, I don't know if that's available or could be included, if you want to comment on that before Sarah wraps it up.
Yeah, absolutely. So Lindsay did ask me, so Healthy Babies, team teaching sheet for life history calendar. It is now on my to-do list. So we will work with the PHN prep team and get a resource out in the new year around an education module that teams could use to do some of this learning and activity as a team meeting activity. So absolutely.
Great. So as we wrap up today's webinar, I would like to thank Susan for presenting and Lindsay for co-moderating with me. I'd also like to thank everyone who joined us for today's PHO webinar. Before we leave, I'd like to mention that on January 18th will be our next session. The title is From Assessment to Intervention, a resource guide to applying NCAST PCI scale assessments in home visiting practice. And registration will be open early next week. So you can expect to receive a brief and anonymous survey for today's session. Please try to complete this to help us improve our programming. Lastly, to access our past presentations and view confirmed upcoming sessions, please visit the PHO website, head to Education and Events, and click on Presentations. Thank you, have a wonderful day, and happy holidays.